The relationship between sleep and heart health is often oversimplified, with most people focusing primarily on getting a set number of hours per night, usually between 7 to 9 hours. While this is a starting point, the American Heart Association, AHA, has recently pushed for a much deeper examination of how sleep impacts both cardiovascular and metabolic health. The organization's updated perspective challenges the traditional view that simply getting enough sleep is sufficient, urging a more nuanced understanding of sleep's role in overall health. But the issue goes far beyond just the number of hours we sleep. The quality, timing, and consistency of our sleep are also critical factors that have profound effects on our heart health and well-being. The ramifications of ignoring these multifaceted aspects of sleep could be catastrophic, especially considering the prevalence of sleep disorders and the growing body of research that links poor sleep to various health conditions, particularly cardiovascular disease. The AHA's recent scientific statement published in Circulation, Cardiovascular Quality and Outcomes emphasizes that more than just the duration of sleep should be considered. While many health organizations, including the Centers for Disease Control and Prevention (CDC), suggest that adults should aim for at least 7 hours of sleep per night, the AHA argues that this recommendation fails to account for the complexity of sleep health. According to the AHA, sleep is not just about quantity, but also about factors like sleep continuity, timing, regularity, and overall sleep satisfaction. These elements are just as, if not more, important for preventing chronic conditions such as heart disease, stroke, and metabolic disorders like diabetes. Recent research has shown that poor sleep, or inconsistent sleep patterns, can have dire consequences on heart health. While it's known that a bad night's sleep is an occasional inconvenience, chronic sleep deprivation or disturbances can lead to severe issues such as blood vessel damage, reduced immune function, and increased risk for obesity. In fact, poor sleep can interfere with the body's natural repair processes, particularly those that are essential for maintaining cardiovascular health. Sleep helps the body repair damaged blood vessels, improve memory, and regulate hormones involved in hunger, all of which contribute to a healthy heart and metabolic system. When these processes are disrupted, it creates a cascading effect on the body's ability to regulate itself properly, leading to long-term health complications. The AHA stresses the importance of looking at sleep through a more multidimensional lens, pointing to a significant gap in current research. Studies have shown that disruptions in sleep quality, such as frequent awakenings during the night, could be indicative of underlying physical issues like indigestion, bladder problems, or even more severe conditions like sleep apnea. Furthermore, the AHA highlights the significant role of circadian rhythms in regulating sleep patterns. If these rhythms are disturbed, whether due to shift work, environmental factors like light pollution, or the overuse of screens before bedtime, the body struggles to maintain a natural sleep-wake cycle. This disruption can lead to excessive daytime sleepiness, poor sleep quality, and an inability to fully benefit from the restorative processes that sleep provides. Waking up repeatedly throughout the night, for example, may signal more than just a restless mind. It can be a sign of an underlying disorder that could exacerbate heart problems. When the body is not able to reach the deeper stages of sleep, essential functions like blood pressure regulation, immune system strengthening, and inflammation reduction are compromised. This is particularly concerning when considering that persistent poor sleep can lead to chronic health conditions, such as hypertension, which is a well-known risk factor for heart disease and stroke. Additionally, insufficient sleep has been shown to increase levels of cortisol, the stress hormone, which, in turn, can have a damaging effect on heart health. The importance of addressing sleep in a comprehensive manner is further emphasized by the AHA's call for research into demographic factors that might affect sleep health. Factors like race, biological sex, and socioeconomic status, SES, have long been linked to health disparities, and the AHA is now urging that these factors be taken into account when exploring sleep's impact on cardiometabolic health. People from lower socioeconomic backgrounds are more likely to face environmental stressors, such as noise and air pollution, which can disrupt sleep patterns. Additionally, they may be more likely to live in neighborhoods with limited access to healthcare or safe, quiet places to sleep. These disparities contribute to a cycle of poor sleep, higher stress levels, and, ultimately, worse health outcomes. The link between poor sleep and increased cardiovascular risk is a major concern. The research points to the fact that lack of sleep is not just an inconvenience. it is a serious health risk. For example, sleep deprivation has been linked to increased blood pressure, higher levels of inflammation, and the production of harmful substances in the body. These biological processes create a perfect storm for the development of heart disease. Sleep disorders such as insomnia and sleep apnea have been found to contribute to the development of atherosclerosis, or the hardening of the arteries, which is a leading cause of heart attacks and strokes. Therefore, the AHA urges that more attention be given to improving sleep health, as it is directly tied to reducing the risk of heart disease and other chronic conditions. Moreover, simply focusing on improving sleep through pharmaceutical solutions is not enough. As Dr. Christopher Berg, a cardiologist, notes, the AHA's statement emphasizes the importance of behavioral changes and environmental adjustments to improve sleep quality. These adjustments can enhance the effectiveness of existing treatments and may reduce the need for medications. Simple strategies, such as maintaining a consistent sleep schedule, creating a comfortable sleep environment, and limiting screen time before bed, can have profound effects on sleep quality and, by extension, heart health. These strategies are especially important because they are relatively simple to implement and have long-term benefits for both physical and mental well-being. However, the broader implications of poor sleep extend far beyond just individuals. Entire communities can suffer from the lack of access to healthy sleep environments. People in underserved areas often face higher levels of stress, noise, and environmental pollutants that affect their sleep quality. For example, people in lower-income areas may live in more crowded conditions or may be exposed to noise and pollution that make it difficult to get a restful night's sleep. This exacerbates existing health disparities, particularly with regard to cardiovascular and metabolic diseases, which are already disproportionately affecting certain populations. Addressing these environmental factors is crucial to improving sleep health on a population level. In conclusion, while the focus on sleep duration has been a staple of public health recommendations, it is clear that the full picture of sleep's impact on heart and metabolic health is much more complex. The AHA's call for a multidimensional approach to sleep health is an important step in understanding how factors like sleep quality, regularity, timing, and the environmental and social context in which we sleep can shape our cardiovascular health. By paying closer attention to the broader aspects of sleep health, we can begin to address one of the most overlooked contributors to heart disease and other chronic health conditions. The stakes are high, and the time to act is now. Ignoring the importance of sleep, or reducing it to a simple equation of hours, could have serious consequences for public health, particularly for those most at risk.